5-year-old child is brought to the pediatric clinic by his mother for a rash that started a few days ago. The mother adds that her son had also had a fever, sore throat since last week. His immunizations are up to date. On examination, a rash is present over the trunk and the upper extremities and feels like a sandpaper to touch. An oropharyngeal examination is suggestive of exudative pharyngitis with a white coat over the tongue. The physician swabs the throat and uses a swab in a rapid antigen test kit. He also sends a sample for microbiological cultures. The physician then recommends empirical antibiotic therapy and tells the mother that if the boy is left untreated, there is a likelihood of developing a complication later in life. Which of the following is the best explanations of the mechanism of the underlying development of complication the physician is talking about? Alright, so option A is antigenic shift, B is bacterial tissue invasion, C is molecular mimicry, D is toxin mediated cellular damage, and E is genetic drift. 5-year-old, very good, rheumatic fever. 5-year-old child who has come to the clinic for a rash. Okay, the mother adds that the son also had fever and sore throat. Okay, so there is a history of sore throat and fever since the past week, and the rash is present over the trunk and sand. It's like feels like a sandpaper to touch. Okay, then oropharyngeal examination is suggestive of exudative pharyngitis, right? So basically, they're talking about strep throat. All right, and this will eventually, if it is untreated or undetected, it will eventually lead to your rheumatic heart disease. And why it will lead to rheumatic heart disease? We will talk about that first. So when you, it is by a mechanism known as molecular mimicry, which I will explain to you by drawing. It's okay, I can explain it like this also. So basically there is something called as an M protein on the capsule. Okay, it's M protein which is present on the capsule of the bacteria. What happens is the body forms antibodies against it. These antibodies are formed against this. Now what happens is these antibodies can cross react with the heart and the nervous tissue, and that is how they can lead to your rheumatic heart disease and other symptoms of rheumatic heart disease, which I will discuss first, and then I will be taking all the questions. All right. So yes. Okay. So like I mentioned over here, so this is your M protein in the capsule. All right. And this will eventually be antibodies will be formed against it. They will be cross-reacting with your heart, cardiac muscle, and the nervous tissue. All right, and that is how you get eventually you get rheumatic fever. The things you should know is the Jones criteria of rheumatic fever, which is a major criteria and minor criteria. So the major criteria is migratory polyarthritis and carditis and erythema marginatum and Sydenham's chorea and subcutaneous nodules, which you can remember as J, heart, nodules. Okay, so this is how you can remember it. The Jones criteria. J is for joint involvement, right? So joint involvement or migratory polyarthritis. Heart is for carditis, and erythema margin. N is for nodules, the subcutaneous nodules, and E is for erythema marginatum, and S is for Sydenham's chorea. Then minor symptoms are arthralgia, fever, and first degree heart block, elevated inflammatory markers. That is your ESR and CRP. So rheumatic fever is diagnosed when you have either two major or one minor and one major and one minor criterion. Either you should have two major or one major plus one minor. Okay, along with the evidence of recent streptococcal pharyngitis. All right. Okay. So yeah. So what? There is some confusion in the diagnosis, which is there over here. So yeah, basically main thing which you have to see in this question is the patient had a history of sore throat, which gives you the diagnosis of streptococcal pharyngitis. Of course, there's a diagnosis of scarlet fever also involved, but that is not a big worry for you. Main thing is you have to figure out why they are giving streptococcus infection to you. Okay, So the strep throat will eventually lead to your cardiac, which will lead to your rheumatic heart disease. All right. Scarlet fever is there, no doubt, because of the sandpaper rash involving your upper extremities and trunk. All right. But the main thing in this question which you have to concentrate upon is your strep throat. Okay, because Streptococcus pyogenes, which is involved, it can cause the strep throat also, and it causes um, your sandpaper rash also. No, it does not refer to your IgA nephropathy, because if they were talking about IgA nephropathy, they would. And one more thing about IgA nephropathy, it does not always happen when you have a strep infection. All right, the Streptococcus pyogenes infection. All right, and when you have a streptococcal pharyngitis infection, it almost always can cause your rheumatic heart disease if you do not have if you have not taken up the antibiotic therapy, if it is left untreated. All right. Yeah. So it almost, to make it short and simple for everyone, it almost always leads to rheumatic heart disease if it is not taken care of, whereas the PSGN does not usually happen when, if it is not, if it subsides, if the infection subsides, it is not a necessity, but this can happen, right?
Thanks for watching. Please give a thumbs up and subscribe for more.